Okay, we are live here with a great topic. Okay, so ladies, you're going to get something in this show. I promise you, but this show is titled Erectile Dysfunction. Okay, but well, I didn't say that meaning like in a really funny way, like you're going to get something because the show's titled Erectile Dysfunction. We're going to talk about stem cell and beauty too, so hang on there because I am not a Botox fan, and this is the only thing that I would actually allow my wife to have because Dr. Amy Kellen, she is a board certified. She was board certified in emergency medicine, which I actually have a lot of respect for. And now you've been practicing anti-aging and regenerative medicine for the last 5 years. So this is how we got onto this topic. And she incorporates integrative health practices and restoring health. And this is what she does. And she also addresses this issue of sexual dysfunction with a really unique way. And we're not talking about little blue pills here, are we? So Dr. Amy, thank you for being with us.
Hi, thank you so much. I'm really excited to be here.
Yeah, no, we're not talking about little blue pills. There's something much safer and actually amazing. And so many people really aren't aware of this. So Gainswave, tell us about this new procedure. Tell us about what this is. But let me start here though. Let me back up because you told me a statistic at the top of the show that 40% of men over the age of 40 actually have some erectile dysfunction, and then it goes kind of 10% every decade. Is that correct?
Yes, that's right. Yeah, it's actually a lot more common than we think.
Yeah. So I mean, and then with that said, I said immediately, well, people are reaching for Viagra, and other solutions like drugs, but there's great consequences to that. I would never touch it, right? But yet this is a simple, safe solution that I would say, I bet you very few, if anybody, has heard of watching this, and I believe it works better. So Gainswave, talk about it. Just give them a brief introduction.
Okay, so Gainswave is a low-intensity extracorporeal shockwave therapy, which is the fancy long name, for essentially using sound waves and putting the sound waves down into the tissue, into the penis. And those sound waves can cause a little bit of trauma that then increases blood flow. So it increases blood vessel formation and repairs the blood vessels that you already have. So in the end, essentially, you have increased blood flow going into the penis and staying there where it's supposed to, and you have improvement in symptoms.
Yeah. Okay. So how quick does it work? How many treatments do you need?
So for most people, we recommend about 6 treatments to start with. And each treatment is super easy, painless, no downtime, about a 30 to 45 minute office kind of procedure. So we recommend 6 over about 3 weeks. And then we may repeat that and do another 6 later on if you have more severe symptoms. But people start to see benefit, even after 3 or 4 treatments sometimes.
Yeah, I mean, so what's if people take the Viagra or the med, right? I don't know the statistics on how well that works. I've never been down that road, thank God. However, how does this compare as far as effectiveness than that?
So, it's a different mechanism for sure. Viagra and those medications work by sort of making nitric oxide work longer, which makes your blood vessels open up for a period of time, right? But they're not actually fixing the problem. They're just kind of getting you through the few hours. So what Gainswave does that's so cool is it actually gets to the root of the problem, which is the fact that you don't have as much blood flow for most people. So you're actually repairing the blood vessels, increasing the blood flow, and then you have results that last a year or even up to 2 years in some cases. So it's not a temporary Band-Aid kind of thing. It's actually repairing the tissue.
Yeah, I mean, I was going to ask you how long does it last? I would argue this: if people make dietary changes, do a lot of the things that we talk about on this show, it's going to last a whole lot longer because they have to, you said it, there's a upstream cause, right? And let's kind of slow that down and look at that a little bit closer because obviously age plays a role. So what is some of the major things that are causing the calcification, the slowing down of blood flow, in that area and leading to this erectile dysfunction?
So almost all erectile dysfunction is a vascular problem. It's a blood flow problem. There are other causes as well, but that's the most common. So, all of the things that can cause atherosclerosis and plaque can cause blood flow problems. So things like, high blood sugar, diabetes, high sugar diet, high blood pressure, cholesterol problems that are out of balance, not exercising enough, anything that causes inflammation in your body can cause inflammation in your blood vessels, including the ones that go to and from your penis. And so we see the problems pretty early in that area of sort of bad lifestyle choices.
Right. Let me ask you this. Could a lot of people have this problem and not really know they have the problem? Meaning that their performance in sex is dropping and they just, they just don't realize that this could actually be the problem. It's a circulation problem driven by what you just said. Does that happen?
Yeah, absolutely. In fact, a lot of patients come in and they're not really sure if they have problems. They're like, it works sometimes, but not all the time. Or, I don't know if it's my relationship or if it's me. Like there's a lot of people kind of second guessing themselves. But we know certainly with age, just the age itself, there's some increased risk of these kinds of things. And certainly poor lifestyle choices along the way is just going to really increase that risk significantly.
Yeah. Yeah. No doubt about it. Okay. So when you described it, I went,
yeah.
Okay, that's me, right? I never had it done, right? But you described something going in my penis, and immediately I was like hiding pens and things, yeah, I just, there's something about that, Dr. Amy.
It's a sensitive area.
I lost a lot of my men viewers right there. They didn't even make it to this part of the show. Well, if they sexual performance issues or erectile dysfunction, they're still with us. So, okay. Talk about this procedure, because I went on your site and I've read about GAINSWave, and is very successful, obviously. And they describe it as like pain-free and simple. That didn't sound pain-free to me, but tell us.
It is pain-free. So first of all, we do a topical numbing cream to make it completely pain-free. If you didn't have the topical numbing cream, you'd feel a little zappy here and there. It's not bad, but it's kind of a little pulsation. But with the numbing cream, totally pain-free. It's not a big deal at all. But basically it's a device and it's like a little mini jackhammer, which I know sounds horrible, but it's not. It just kind of goes up and down really quickly onto the skin itself. And it sends these sound waves into the penis. And the shockwave therapy name does sound really scary, which I think is one of the reasons that GAINSWave, we call it GAINSWave and not shockwave therapy because it sounds a little bit better. But there's a whole protocol that we use that's really effective, but not painful at all. And there's no downtime. So you come to the office, you get the procedure done, you're done in an hour or less, and then you go to lunch or go to work or go back to exercising or having sex or whatever you want. Like there's literally no downtime at all. So it's nice.
I have to tell a funny story, and I'm not going to give up names, okay? But I'll just say a friend of mine, so he got this done. And now let's just say this friend of mine is definitely curious, okay? So he didn't have erectile dysfunction, but I know that people do this for performance, size, etc. So we're not going there today, but I'm just saying this person.
But they do, yes.
Yeah, all right, they do, because that's all actually related to blood flow, right? And this
right.
Okay, so he had it done, and the story goes, he went to his grandma's, and let's just say he had a pop tent the whole time he was there before grandma's. Okay, so now we hear direction for more than 4 hours, call your doctor. And I always say most people will be wanting to call everyone they know, at least at the age of 40. But anyway, so that was his story. Now he had nothing but good things to say, except his visit to grandma's when he was, hiding under the table, and we'll say like that. So I said all that just to ask this one question.
Yes.
Is there a time where maybe you don't want to go back to work, that you could get that much blood flow and literally have an erection for a day, a week? No, I don't remember how long it lasted.
For most people, they don't have quite the same reaction that person who also wrote a magazine article about it did.
Technically, I could use his name, I guess, right?
I feel like you can, but certainly your erections are still controlled by you, by your brain, by your interests and by your environment and things like that. So it's not like it's going to cause something to happen that you don't want to happen usually.
Okay. And I can attest to this personally. I've never had it done on my penis. That sounds a little more, but I did have it done on my neck, right? And it actually felt good. So, after that, I wouldn't have been afraid. But actually, which brings up another topic. I mean, I know it's used for other, things. It's actually approved for pain as well, correct?
Yeah, exactly. So it's used a lot for musculoskeletal pain. It's been used for many years in many countries, fasciitis and tendon problems and muscle strains and all kinds of things. There's all kinds of things it's being used for now. It's used for healing ulcers, like non-healing ulcers to increase blood flow. It's used for cardiac heart, like when you have lack of blood flow to the heart, there's some studies that show it increases blood flow. So anytime you need to increase blood flow, it's actually shown to be helpful in those situations.
So, I talked about calcium, and it breaks up some of the calcium. Now, I know Peyronie's disease, and this is actually, I don't know the statistics on this as well, but it's where the shaft actually gets bent. And I mean, literally, you can get really bent to where you can't, have normal sexual function.
Yeah.
Are they using it for that? And what's the kind of the success rate?
Yeah, they are. There's a number of studies that have been done, mostly in Europe, with Peyronie's disease. So Peyronie's, you do get these like fibrous kind of scars almost inside the penis that causes pain, it causes curving, and it can cause erectile dysfunction. So we can actually put the shockwave therapy, the Gainswave, on the plaque itself, on the scar itself, to help break up that scar tissue, and then you would apply it to the rest of the penis just like you normally would to increase blood flow. As far as numbers, it depends on what you look at, which studies, but 50 to 60% of people who are having this type of therapy seem to have improvement either in curvature or pain or ED or all of the above. And then if you combine them with other therapies like PRP and other things, then you may even have an even higher success rate.
Which, by the way, I wanted to, matter of fact, you can tell them how to get in touch with you in your clinic, because you do a lot of different things. So your success rate with all of this is going through the roof. How do they get in contact with them? And then kind of with you, I'm sorry, and then kind of go through your procedure with, even some of these more severe cases?
So my name is Amy Killen, and I have two different clinics. I have Doceri Medical, which is in Park City, and I do stem cell procedures up there. And then I also have BioRestoration Medical, which is down in Salt Lake. These are both in Utah, both pretty easy to get to. And I do the Gainswave as well as PRP down there. So I kind of do a little different things at each clinic, but they're pretty close to each other.
Yeah, well, ladies, we're gonna talk about some of this better than Botox stuff too, because you also do that. But yeah, I mean, it's nice about where you are because people can fly in, and you're literally, 20 minutes from the airport. So
it's a great destination. You can come in and ski for a few days, and then get your procedures done, and then go back home.
Hey, believe me, I live here, so it's ironic too, because I'm not interviewing because you actually live, here in my town. They said, oh, you have to talk to Amy. And then I'm also interviewing Dr. Harry Adler, who is a stem cell expert, spoke with me at Bulletproof. Yeah. So that's an interview coming up, folks. And you work with him on a lot of the stem cell works too. But so he was saying to me, oh my gosh, Dr. Amy, you're going to love her. She's adorable. So anyway, that's the kind of reputation you have. But no, you have an amazing where people fly in, like they do Harry. And, they get this work done.
We work together, Dr. Adelson and myself. We'll have patients that'll come in and kind of get this full body makeover kind of thing with stem cells, where they'll come in, they'll get their neck, their back, their joints treated at the same time with the same stem cells. I'll do injections in the face for facial rejuvenation, in the hair, in the penis, or in women, we do the O-shot, which is vaginal and improvements and sexual optimization for women. So we kind of work together and do all those things sort of in one sitting.
That was we'll shift over there, but the Gainswave. I mean, does this do you use it women vaginally or other aspects for them?
So it's a good question. We're actually starting to study that because it's a similar anatomy. Obviously, the clitoris is similar to the penis. It hasn't been studied like in the literature. There's not like dozens of studies like there is with men on using it for women. But we've had a number of patients who seem to have good results from it. So it's something that's super safe, and I think that we'll see more of it in the future. But right now, it's still kind of in the investigation phase.
Yeah, and like I said, I mean, your procedure, the PRP, kind of explain some of the other things you do. So you're doing the Gainswave and some of these other things when it's needed.
Yeah, so I love to pair the Gainswave with the P-shot or Priapiscot, which is basically taking some.
I'm just these words are pretty funny. Go ahead.
It's taking some of the patient's own blood and making platelet-rich plasma from it, which is the growth factors from platelets. So we can essentially just take that blood, centrifuge it, and then we inject the platelets into the penis with a very small needle, and it's numb and it's not a big deal. But we can do that, after one of the Gainswave treatments. And so essentially you've created a little bit of this micro trauma to the penis with the Gainswave, and then immediately you're giving these growth factors that are just going straight to the trauma site and healing it really nicely and really quickly. So that pairs really well. I do that with almost all of my patients who are getting the Gainswave treatments. And then we can kind of go one step above that if we want, and we can actually add stem cells or exosomes or other things like that that are giving you even more signaling power into that area with injections as well.
Yeah, and the other thing too is I thought the Gainswave, I mean, when you look at this problem that people are having, it ruins lives and relationships, I thought it was really reasonably priced, frankly. And I think it's probably different for everybody depending on what you're doing, how many treatments, right? But I mean, talk about that, because for me, I thought, gosh, that, this is a major issue that people are going to either end up on medications, for how long, which are damaging, devastating, and have side effects. But, talk a little bit about that.
So, the cost, you want to get at least 6 treatments for most people. The cost is about $500 per treatment. So it's, does cost some money, but if you look at it sort of from a long-term perspective, you're going to be you have results that are going to last a year or two, and you're not necessarily having to do anything else, do any injections at home or take medications at home. And again, we're really trying to get to the root cause of the problem. It's also important to note that I don't just do these procedures and walk away. I also talk to patients, and we do sort of in-depth and treatment evaluations, and we look at other things. We look at their hormones, we look at their lifestyle, we look at their inflammatory markers. We kind of go through what are you doing that we can improve upon so that you don't have this sort of buildup of damage down the line.
Well, look, you were recommended as the best and the person that we needed to interview. So that's why people fly in to see you. So,
thank you. Thank you.
No, you earned it. So let's shift over, to some of the lady things, right? I mean, look, before we leave the sexual, the dysfunction here, so what are some of the other things that you're doing? Because you mentioned an injection vaginally that you do. What was that?
So that's the O shot, or the orgasm shot for women. It's actually 2 injections. We do 2 different spots. We numb it up first again.
Shot, the P shot, right? Okay, so the O shot.
But it's the same kind of thing for women. You're going to put the PRP, which is platelet-rich plasma, we do it into the clitoris itself, as well as the anterior vaginal wall. And so it can help with things like improving blood flow, improving sensation, it actually can help with stress urinary incontinence. So women who kind of have a little bit of leaking when they, jump up and down or sneeze, we can see improvements in that with the PRP as well, and improving, orgasm strength and things like that. So it's a great thing for women who are, whether they're having problems or not, just kind of improving the health of the tissue in that area using your own body. That's
are they using this, in any disease fashion as well, like cervical dysplasia, anything like that?
They're using it for lichen sclerosis. There's a few lichen sclerosis studies where you kind of get this fibrous scarring tissue in the vagina and the labia, and it seems to be effective for that. I've also seen some studies where they're using it just for stress incontinence and urge incontinence, so 2 different types of bladder leaking. That if you inject the PRP into specific areas, you can actually increase collagen production, you can increase blood flow, and sort of the health of the tissue in those areas, and also for vaginal atrophy. So women who are older, postmenopausal women who maybe don't have estrogen on board, and they start to get a lot of dryness, which causes that vaginal skin to get really thin. And so this is a great thing for that too. You can increase the blood flow, and then you have better lubrication and you have healthier skin.
Yeah, which by the way is a huge problem. It seems like that problem is getting, again, just like all of these topics that we're talking about, they're getting more pronounced. So, huge solution. All right, I opened it up by talking. I hear my echo a little bit. I don't know if it's on my end or yours, so I apologize for that. But let's talk about this, because I said that my wife, I won't let do Botox because I have seen negative consequences from autoimmune to a lot of different things. So I see people with all types of different unexplainable conditions, and Botox is sometimes when this happened and this this occurred on the back side of it. So she won't do that. I don't like the way it looks anyway. That's me. All right. So with that said, why is stem cell, I think, the future? One of the things I like about it, and again, my wife has never had it, but I would allow her to do this, and you'd be the only one that I would have to. But
oh, thank you.
you don't lose the normal face.
Right.
You know, if anything, it just increases the hydration elasticity. So talk about that, why this is a good option.
Yeah, so it's a regenerative therapy. So again, using platelet-rich plasma, using stem cells, and then we inject it into the face, and then I also do microneedling, which is little needles that go in about 2 millimeters. So I can kind of get the skin from the outside as well as from underneath. But basically, you're stimulating your own stem cells that are already in your skin to start kind of getting back to work. So you're telling them, hey, we need more collagen, we need more elastin, we need more hyaluronic acid. These are all the things that make your skin more youthful. So what's great about these procedures is you're not stopping the muscles from moving, so you can still make all your expressions. You're not putting, artificial fillers or things like that in your face that make your face weird shapes or things like that. It's not a facelift, so you're not tightening the skin that way, but you're actually creating healthier skin. So it has improved, blood flow, color, tone. You're helping with the pigment that kind of can kind of get in the skin. It can help to increase the thickness of the skin. So in areas like under the eyes where your eyes are kind of, it's thinning out. So it's a good way to increase the health of your skin. And that helps with the way you look in the end.
Yeah, no doubt. So how people get the big circles under there, does it help? It helps with that?
It helps with the color and the skin thickness. So it can help because the capillaries that leak underneath there, we can kind of help with the leaking by putting the PRP and stem cells in there. And then if you can get that skin just a little bit thicker and a little healthier, then you wouldn't see that depression as much. It doesn't do everything. Certainly there are things like it doesn't stop your muscles from moving. So you're still going to have wrinkling, and it doesn't provide as much volume as certain other products. But I do think it's a really nice thing to have, especially in people who are averse to using other types of therapies for their face.
Yeah, I look at Botox and those things. Again, I don't like the look, right? And I don't like the health aspects. So, that would be out for primarily. But,
yeah,
I think this is actually adding health to your skin. It's the exact opposite. I mean, to me, it's not cheating. To me, it's like, it's just this thing that, you can turn back the clock to where you are. I mean, maybe, I don't know, you tell me 10, 20. I mean, what do you guess it turns back the clock on your skin?
Everybody's a little bit different. Everyone kind of has different responses. Definitely, I think certainly, 5 or 10 years in a lot of people. The other thing that these procedures do that has been shown in animal studies is that actually it helps protect from photo damage. So from sun damage going forward.
Okay, I'm
pretty cool, right? I know.
Well, I'm 52 years old, so see these dark spots. I spent my life on.
And as we know, sun damage is what ages our skin. That's the main thing. I mean, other things do as well, but that's the main thing. So if we can protect from some of that oxidative damage and stress, just using our own bodies and our own cells, then that I think is pretty awesome.
Yeah. What about some of this for hair? Regrowth, things like that.
Yeah, we do. I do also hair injections. So for hair restoration, I just do some scalp injections. Men and women both. Very commonly, men who have male pattern baldness will do those areas, and then sometimes women will have kind of diffuse hair loss. Maybe it's an autoimmune disorder or thyroid problem or iron problem or whatever. And I recommend treating those problems as well. But these treatments can seem to help increase the follicle activity and hair growth.
Wow. I'll tell you what, maybe we have some viewers and we're going to go into more depth with Dr. Adelson, but, stem cells. Talk a little bit about stem cells because people are going, what? Tell them how they're harvested, why they're safe, and why they're effective.
So stem cells are the cells in your body. You already have them. They're the cells everywhere in your body that are responsible for replication and division. So keeping your body, your organs functioning and such. So they're the cells that as you get older, you don't have as much activity in those cells. So for instance, in your skin, the stem cells are the ones that tell the other cells to make collagen and elastin and all the things that make your skin healthy. And as you get older, those cells are not as active anymore. But what we can do now with stem cell therapy is we can take stem cells from other parts of your body. So for instance, your bone marrow or your fat or other areas, and we can then kind of concentrate them and then put them somewhere else in your body. And so it's basically a way to talk to the stem cells that are already in your body and give you a new dose of stem cells. And then there are some other really cool things like exosomes, which we're starting to use in the next few months, which are sort of like the messenger part of stem cells that we can use. PRP is another, it's kind of like stem cell fertilizer. So all of it is basically trying to get your own body's stem cells to kick themselves back into action like they did when you were younger and stop being so darn lazy.
Yeah, I mean, kind of different question. We talked about PRP. It's a little different. It stimulates your own. You can explain that. I had PRP. Well, technically it's called PRF. When I had a cavitation taken out, they put the plasma-rich fiber in there, so you don't breathe cavitation. And I also had some PRP in my neck, where I'm getting the makeovers. I mean, Harry is going to, my neck, because I had a back issue years ago, and some prolozone PRP, it helped, but it's still, it needs it. So, and by the way, all of you, stay tuned, because I'm going to film the whole thing. So,
yeah. We love that.
Really cool. So you'll actually get a really cool look at, I mean, Harry goes in, I mean, with camera, and you're going to see the needle going into my disc and my back and my facet joints. So,
oh, that's going to be awesome. Yeah.
Yeah. So we're going to do that. I mean, I've been researching the stem cell thing for, I would say pretty hard for a year and a half, where it was, kind of things start to come out. Like I kind of look at things, interview the best, talk to the best, read, look. And I tell you, I'm convinced that it's not only safe, because that's kind of like the first priority, but that it works. I mean, it really does work.
It does.
Remarkable. I mean,
safe. There's really no there's no downsides except for you can get bruising and you can get that kind of thing that you'd get with any injection, but it's your own body, or you're getting them from somewhere else, but they've been totally screened and they're safe. So it's pretty cool. I think getting your body to heal itself versus taking some other medications and things to try to mask symptoms is really the medicine of the future.
Yeah, and Harry, my medial meniscus on my knee, years ago, right? It's like, and I don't have any pain. Even like as I sit here now, I don't have pain, but my back is injured. If I go skiing and then it's injured, right? And just all the tissues are weakened. And it's Harry's like, look, yeah, that'll change. Once we do your spine, and he's going to do my knees too. That's why,
yep.
The whole thing. Yeah, I mean, but I'm telling you, we can turn back the clock. And when I explained to my wife what it does for the skin and the elastin, she was like, okay, that's the only thing I would do.
Yeah.
She doesn't get, I have to clarify, she doesn't get Botox because I don't allow her. She doesn't get Botox because she wouldn't either. So just so you know.
Right. Well, we can do both of your faces and whatever else you want injected when you come see me.
I have my hair. I'm good there. But my back's a different story. I need to turn back the clock for sure. Yeah. So, okay, am I missing any other things that you do that you want to talk about, or even that we need to talk about even with these procedures?
I think just the idea of doing the procedures and then also looking at just general health is really important. It's really important for instance, for sexual function. You want to look at sexual function as an indicator of general health and not just sort of its own little small thing. Because we know that, erectile dysfunction, for instance, it's a precursor for atherosclerosis, for heart attacks, for strokes, for things like that. So it's important that we have this awesome technology that we can treat the problem, but it's also really important that the patients know why they got the problem, and that this can continue, and later on you may have other more serious problems if we don't address what's causing it in the first place.
I'm glad you bring that to people's awareness, right? Because okay, this is an amazing technology, but you continue to do the things that people do. You're right. Erectile dysfunction, you're going to end up with a heart attack. If those the vessels supplying the penis are being affected, so too are the ones supplying the rest of your body,
right?
Attacks and strokes, etc. So, and by the way, we take this show, we deal with that continually. So this is kind of a topic for us. So this is kind of neat. Usually we're down here talking about how toxins, lifestyle, many aspects of health, but erectile dysfunction, we don't think about that as being a symptom of deeper rooted problem. So
Absolutely. Yeah. And that's, that's also true for skincare. It's true for everything that we do. Essentially, you have to treat, we can do what we can at that area, but you also want to look further and deeper. Are you avoiding the sun? Are you eating right? Are you avoiding toxins? Are you, all the things that you talk to your patients and audience about? Those are all important for everything. And to get the stem cells to be healthy enough to use, I don't treat patients that are smoking actively, because if they're smoking, their stem cells are not as healthy and they're not going to be as good when I do the procedures. So, just some things like that. We want to make sure that when we get your stem cells and we use them, or we get your PRP and we use it, that it's good stuff, because these are procedures that you don't want to just do for no reason. So staying healthy and doing the right things is really important to make any of this work.
Yeah, one of the topics that you would love, but I speak a lot about, is fasting. And fasting states, and I fast every day, daily fasting. So I fast for a period of time before my first meal, and then periodically we do longer fasts. And we know the autophagy occurs, meaning the body's so smart, it gets rid of all the bad cells in every part of the body, and then it raises up stem cells that literally, create healing. And it's amazing to watch. It really is. So if you do the things that we talk about on this show, but for those things that are just too damaged, like my back and my knee, that's where this can really make a massive difference. I mean, it's remarkable. I mean, for our body to produce that many stem cells, is virtually impossible.
Yeah, no, it's amazing. It's really cool. And I feel very fortunate to be able to do this kind of medicine that's always changing, kind of in really cool directions all the time.
Yeah. Well, look, I'm going to embarrass you a little bit. Okay, your skin looks amazing. Okay,
thank you.
So, have you done this in yourself, the stem cells?
I have. I've done stem cells to myself. I had someone else get the stem cells out, and they injected them on me because I couldn't do the injections myself. And that was a couple of years ago. And I've also done PRP injections on myself, actually on myself with a needle in my own face, which was kind of tricky. And then I do, I do other things as well as good skincare, and I make sure I wear my sunscreen. I also am a big fan of low-level light therapy. The red light therapy for skin is amazing. So I do that whenever I can, kind of as like my sort of downtime meditation kind of thing. But yeah, so anything I do to patients, I always try to do it on myself first. I think it's important that if it's going to work, I need to make sure that I know what it feels like and what it does.
Honestly, me too. I won't promote something unless I've done it myself. Although I promoted Gainswave, but I would do it. I would.
There's still time. You can do it at some point.
But I do the red light too. We call it Juve Light. I've interviewed them here on Cellular TV, and yeah, it really does. It makes a big difference. So
it's great. It's a good nitric oxide booster too, which is good for all the things that blood flow related things. So I'm a big for skincare as well as other applications. Acne prevention is great for that as well.
Yeah, no doubt. My kids use it for that. They're in there all the time on my Juve Light, right? So my wife and we use it every day, honestly. And there's another device called a Beamer that increases circulation, capillary circulation, because I mean, honestly, that's the key to staying healthy. Is that's what you're talking about. Well, give them your website again. How do they get in touch with you? Go ahead and give them that information again if they missed it.
So Docere Medical, which is DOCERE medical.com, is the one for stem cells. And then I also have another one, which is biorestoration.com. And that's where I do the Gainswave and I do some of the hormones and other integrative therapies. So, and again, it's Dr. Amy Killen. Amy B. Killen is my name.
Killen. She is. Now we got in the know. So, and she's from right here. You're all the way up Park City office in Salt Lake, fly just right in from the airport. Now, listen, it's great. You're doing great stuff. I mean, I'm telling you, my audience will absolutely love this because it's the healthy solution. It really is. And, it's cutting edge. You're doing all the most cutting edge stuff. Thanks for being on the show. I appreciate it. And I'll tell Harry, he was right.
Thank you so much. This was so fun.